Ever wonder what really happens to your pelvis and tissues during and after childbirth? In this episode, I talk about the process of resetting the tissues post-birth, helping everything find its way back to optimal position for recovery and renewed strength. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everyone. Welcome to this episode. And today I want to talk about this concept that just came to me as I was working on one of my clients. And that concept is resetting. And what I mean by that is I want you to think about what happens to the pelvis and all the pelvic tissues internally as that baby is coming out vaginally. And think about how that baby's head is expanding the entire area and dragging everything down, especially the soft tissue in that vaginal space, down as it comes on out. And I was working with a client this week when I realized it's like, oh, some of my intention when I'm working with the tissue is actually resetting it back up into its original position. Now, it may have fallen, it may have just energetically been dragged down, yet I find I used to do this with some of the structures, and then now I'm realizing more and more that our intention as body workers doing intravaginal work, working with the pelvic bones, needs to include this idea of resetting the tissues to their original position. And so let's think about it from different layers, okay? So first off, the bones. I've always been talking about the open birthing pattern in the pelvis and how the sit bones have to widen for baby to come out and the sacrum has to go into flexion. Well, we are resetting the bones back to their original position when we bring the ischiums medially and when we bring the sacrum into more extension. And I almost like to think as I'm encouraging tailbone to come up towards pubic bone, I'm thinking of like that clamshell closing itself back up again. And so one palm on that lower sacrum, the other palm on the pubic bone, as I'm encouraging those tissues to close back up again. So that's resetting of the pelvic bones. Now, the next piece is if we go intravaginally and think about what happens to the bladder. The bladder, as the baby's head is coming through, tends to get smushed over to one side or the other. I find it more to the left. And so we're resetting the bladder back into the midline, and we're also resetting it back up onto the shelf. So for those of you that have studied with me and taken the postpartum course, and especially live, I talk more about it in the live courses about bringing the bladder back up onto the shelf. We are resetting those tissues back up onto its shelf. So the pubocervical fascia, that's what we're working with here. And think about what happens if they tore at that opening. That scar tissue can be pulling those structures down. Anna Krall talked about this in her summit interview years ago. And she also wrote a couple of papers on this that got published. And we need to help reset those tissues into a more upward and away from the scar tissue direction as we are releasing the tissues and resetting them back into their proper place. We need to help reset the cervix back into its proper place. And a lot of times I find that maybe if a cervix is low, we need to encourage it to go back up. And by just compressing that cervix anteriorly or superiorly in that vaginal space, to me, I feel like we're resetting the uterosacral ligaments. We're offering more tone to the uterosacral ligaments and tonifying them again. And that can also happen if the cervix gets really pulled posteriorly after birth. Bilaterally, that cervix is really posterior and doesn't like to come forward. We're just resetting the tone of the ligaments supporting the position of the cervix. And then for the muscles of the pelvic floor, when the bones have been splayed apart and the sacrum is backwards, those pelvic muscles are lengthened. And we need to think about, as we're working with them, about resetting them into a more normal length for them. And that's why I use the bones of the pelvis to help put pressure, to help gap or slack the pelvic floor muscles so that the muscles can learn to reconfigure in a more shortened position. And then the last area of the last set of tissues, we're resetting the perineal body. Sometimes that perineal body is really descended and has come down. Sometimes that can be from a defect. So there may be some things that we can't reset because the tissues are defected from the birth. They tore, the ligaments is no longer attached where it's supposed to. But if everything's still intact, we can help those tissues to move back up and inside. And I did talk about this in my the holistic treatment of the postpartum body course with the working on the EAS. And that sometimes with the EAS, after I've done all the release work and releasing all the knots in there, sometimes I feel like I just need to help it to reset itself back up and inside of that vaginal space. Because if you have ever watched a video of a baby coming out and seen the sphincter muscle as that baby's head is coming through, you will recognize why there are so many knots in that tissue after birth. It gets so expanded and so pushed out. And what I'm talking about with resetting is helping to reset those tissues back up and inside of that vaginal space. And so I hope, still doing the techniques that I taught you in my courses, but think about doing them in this concept of resetting them back to their original position. And that, I think, just allows the tissues to be able to function better after birth. And in doing the intravaginal protocol, I have to say that I am continually flabbergasted, surprised, in awe of the amount of change that I'm able to make in the tissues in one session. And my clients feel how much stronger their pelvic floor muscles are in that one session when we address everything that I'm talking about here. So keep this concept in mind of resetting the tissues back up and into their original position, and think about what that baby did as it was dragging all those tissues down and out as it came out. We need to reset them back up and in to help them to find their original position again. Okay. So I hope you got some concepts here you can take into your clinic and start working with your clients in a way that helps to get the tissues back to their original position after that baby has been born vaginally. All right. Thanks so much for listening in, everybody. And if you haven't already, please check out my holistic treatment of the postpartum body course, because that will definitely help you to learn all these techniques that I was talking about and how to release the tissues. And it really is after the release work that we want to figure out how to help reset those tissues after that. All right. All right. Thanks for listening. And everybody, here is to smoother births, faster recoveries. Much love to you all. Take care. Bye-bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code podcast50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.